What color should jelly-like discharge be in early pregnancy?
Hello, and welcome to our discussion about early pregnancy symptoms. Today, we will focus on jelly-like discharge that you might notice in early pregnancy. As with many things related to pregnancy, there's no one-size-fits-all answer, but we'll aim to provide a broad understanding.
What is jelly-like discharge?
Jelly-like discharge is a type of vaginal discharge. It's normal for women to experience some amount of vaginal discharge throughout their menstrual cycle. This discharge is typically clear or whitish in color and can have a slight odor. During pregnancy, you might notice that this discharge increases or changes in texture, sometimes becoming more jelly-like.
What is normal jelly-like discharge in early pregnancy?
In early pregnancy, you may notice an increase in vaginal discharge. This is typically due to the increase in estrogen levels and more blood flow to the vaginal area. The discharge, often referred to as leukorrhea, is usually thin, white, milky, and mild smelling. It can be jelly-like, and its primary function is to protect the birth canal from infection.
When should I be concerned?
Changes in the color, consistency, and smell of your discharge could potentially indicate an issue. If your discharge is green or yellow, this could be a sign of an infection. Gray discharge can be a sign of bacterial vaginosis. Brown or pink discharge might indicate spotting or light bleeding, which can occur in early pregnancy but should always be checked out by your healthcare provider. If the discharge is accompanied by other symptoms like itching, burning, discomfort, or pelvic pain, these could be signs of an infection or other medical conditions that need to be addressed by a healthcare provider. Any blood in the discharge, especially if it's bright red or if there are large clots, could be a sign of a miscarriage or ectopic pregnancy. This is a medical emergency and requires immediate attention. In summary, jelly-like discharge in early pregnancy is usually normal and should be a white or clear color. However, if you notice any changes in color, smell, or consistency, or if you're experiencing any other symptoms like pain or bleeding, please seek medical advice immediately. Always remember that when it comes to your health, it's better to be safe and ask questions. Thank you for joining us in today's discussion.